Let's turn to the CBC's JP Tasker, who's following the story for us from Ottawa. So, JP, applications open today for the dental care program. So, what should parents know?
Yeah, so eligible parents can go online to the Canada Revenue Agency's website and start to fill out that application to get some cash from the government to help offset some of the costs associated with dental care for kids. As the Prime Minister mentioned there in that clip, it's for families with a net income of $90,000 or less, net, of course, being after taxes. And an important stipulation that our audience should know about as well, it's not for people who already have private insurance. Many people in this country already have some sort of dental care through their workplace. Some low-income people in some provinces and territories also have access to dental care services through some provincial programs. Those folks are not eligible for this dental care plan from the feds. So if you apply for it and get the cash, that might be clawed back at the end of the tax season. So some experts are warning folks, don't just go online and sign up for this if you know you already have coverage elsewhere. This is really only designed for people who do not have access to dental care. And the Prime Minister was clear today that there are a lot of people that don't have dental care in this country, even though there is a large private insurance market already. About 1/3 of all Canadians do not have access to dental services or can't afford it. So this program will help out a lot of kids. About 500,000 kids across the country will be eligible for this program once it's up and running. This is a bit of a stopgap measure. They're sending checks, about $1,300 over the next 2 years to families who are eligible, but they really intend to stand up a more permanent national program that will not just be money coming from Ottawa to parents' bank accounts, but really more of a Medicare system like we know today with other healthcare services. So the federal government taking some time over the next 2 years to stand up that program. But in the meantime, checks are coming. This is part of that NDP supply and confidence agreement that was reached earlier this year. The Liberal government sort of being forced, if you will, by the NDP to implement this program by the end of this year so that they can count on the support of NDP MPs for the next 2 years. The NDP has said they will support this government based on certain conditions. One of the big ones being this multi-billion-dollar dental care program that rolls out today.
And JP, the Prime Minister was also asked about MAID, medical assistance in dying. And I think this is a story you and I and others are going to be covering a lot over the next weeks and months. Tell us about that.
Yeah, absolutely. So some psychiatrists in this country, an association that represents some of the top psychiatrists, was out this morning with concerns about how the MAID program is structured moving forward. You might remember this was rolled out in 2016 for people with physical ailments, terminal cancer, other things that might imply that death is imminent. Well, the program is going to be expanded to also include people with mental disorders and mental health concerns. And a lot of psychiatrists are saying our system is not ready for this just yet. We don't really have the proper systems in place to police it, and we're concerned about abuse. We're concerned that this system might be taken advantage of. So they want the government to kind of hit the pause button, go back to the drawing board and make sure the country is ready, make sure doctors are ready to prescribe MAID for people who are suffering from mental disorders. The Prime Minister was asked about this today at his press conference in London, Ontario. Here's what he had to say about that.
Medical assistance in dying is an extremely difficult and personal issue for individuals and families. As a government, we need to make sure that the framework and the resources are in place for people to make informed and proper decisions. We've always striven as a government to be there to support people's rights and their choices, while at the same time making sure we're protecting the most vulnerable.
So the program was supposed to be extended to people with mental disorders in mid-March of 2023. We'll see if the government sticks with that timeline. We'll see how things shake out now that some psychiatrists are coming forward and raising serious concerns about people being taken advantage of. Andrew?
But just very quickly, JP, so far, no indication, I'm trying to kind of, is listening carefully to what the Prime Minister had to say. No indication so far that they are going to hit the pause button, right?
No, I think if you can parse his words there, it seems like they are moving full steam ahead with this program as originally designed. This was something that came about because of a court ruling in Quebec. The court there finding that the current limitations on medical assistance in dying were unconstitutional and that MAID should be an option for people who are suffering with mental disorders. So the government's hands are a bit tied in this case because they are responding to court action from a number of years ago. They've blown past a number of deadlines on this. So I think their intent on pushing ahead. They still want to have the parameters include mental disorders and mental health. But the Prime Minister signaling that maybe there can be some wiggle room here, maybe there can be some more time to listen to experts and people across the country who might have some input on how this should actually be structured when it's up and running.
All right, JP, thank you. The CBC's JP Tasker reporting live from Ottawa. Let's go back now to today's dental announcement. And for that, I want to bring in Wendy Stewart. She is the immediate past president of the Canadian Dental Hygienists Association. She joins us now live from Halifax. So Wendy, what was your reaction to the rollout of this program?
I was very pleased about the rollout of the program. As a member of the board of directors of the Canadian Dental Hygienists Association, we've been advocating for years for increased access to care for all persons living in Canada. And we believe that this program is a good first step and a step in the right direction to having equitable access to oral health care for all persons living in Canada.
So the subsidy is only available to some Canadian families, so you need your household less than $90,000. Do you think it goes far enough?
As I mentioned, I think it's a great first step. My understanding is the program that is being rolled out now is for 2 years. It's an interim program. This year, it's for children under the age of 12. Next year, it's supposed to be expanding to people under the age of 18, seniors, and people living with disabilities as well. And eventually, all families with incomes under $90,000.
So some dentist groups have expressed concern that a national program could interfere with provincial subsidies and actually reduce access. What's your take on that point of view?
I think it really depends on what province that you come from. As a dental hygienist, I'm pleased the dental hygienists are included as eligible providers with this new plan. Access to care is so important for me, and every child, it's important that they have access to the services I can provide. For example, in my province, and each province is different, independent dental hygienists cannot be reimbursed for the services that we provide under our current MSI plan. This impacts who can receive our care. So with the new federal plan, independent dental hygienists can be reimbursed as we're recognized as providers, which should open more avenues for oral health care, especially those in remote areas where there might not necessarily be a dentist.
And tell me why, just from a personal perspective, from what you've heard from families, from kids, about why this is important.
It's important because prevention is key and oral health is so important for overall health. I do work in a clinic 1 day a week where we see children from a lower socioeconomic status area. And I regularly see teeth that have cavities, sometimes on all 20 baby teeth. And the children sometimes have abscesses, which are painful. And poor oral health care means that they're in pain. Sometimes they're on a wait list to get into the hospital for surgery, which is costly. It also impacts them on a social level. So if you can't smile, if you can't speak because you have pain in your mouth or teeth that are missing for enunciation, it can be very detrimental to their mental health as well.
All right, Wendy, thank you. Wendy Stewart is the immediate past president of the Canadian Dental Hygienists Association. She joined us from Halifax.